Imagine you're at home and suddenly someone gets a deep cut while cooking, or a child falls and gets a small wound. Maybe someone accidentally touches something hot and gets a minor burn. The first few seconds can be confusing because everybody starts looking around for something to use. Someone is shouting, "Where is the cotton wool?" Another person is searching for antiseptic. Someone else is saying, "Just put toothpaste on it." And that's exactly why having a properly prepared first aid kit at home is so important. A first aid kit isn't meant to replace a hospital or a doctor. It's there to help you handle minor injuries and emergencies safely while you decide what to do next. But here's the interesting part. Many people have a box, they call it first aid kit, yet it's filled with random medicines, expired products, or things that shouldn't even be there. So today we're going to simplify it. I'll show you the essential items every home should have, what each one is actually used for, and some common things people keep in their first aid kits that you should think twice about using. And by the end of this video, you'll know exactly what to check for when you open that first aid box at home. So let's get into it. 1. Adhesive bandages and sterile gauze. Let's start with two of the simplest things, but also two of the things you may reach for most often: adhesive bandages and sterile gauze. A small cut from a kitchen knife, a scrape from a fall, or a minor wound can happen very quickly at home. And when it does, you don't want to start searching through drawers for something clean enough to cover it. Adhesive bandages are useful for small, superficial cuts and scrapes after the wound has been cleaned. They help protect the area from dirt and friction while it heals. Sterile gauze is useful when the wound is larger or when you need something that can absorb blood and help apply gentle pressure. And here's something important. The goal isn't simply to cover a wound immediately. Clean the wound first with clean running water, when appropriate, and then cover it with a clean dressing. If a wound is deep, gaping, heavily bleeding caused by a serious bite, or you can't get the bleeding under control with firm pressure, don't rely on your first aid kit alone. That person needs medical attention. So, when you're checking your first aid kit, make sure you have different sizes of adhesive, bandages, and several sterile gauze. Pads and check that they're still sealed and within their expiry dates. 2. Disposable gloves. The next item is something people often forget when putting together a first aid kit. Disposable gloves, you might be thinking, why do I need gloves in my own house? But imagine someone has a bleeding wound and you need to help them. You don't want your bare hands coming into direct contact with blood or other body fluids. A pair of disposable gloves gives you a basic layer of protection while you're helping. They can also help keep your hands clean when you're cleaning or dressing a wound. Ideally, keep several pairs in your first aid kit rather than just one pair, and make sure they're stored in their original packaging and haven't been damaged. When you're putting gloves on, avoid touching unnecessary surfaces with the contaminated outside of the gloves. And once you're finished helping, remove them carefully and wash your hands thoroughly. But remember, gloves don't make you completely protected from infection. Hand hygiene is still important. So if you're building a first aid kit from scratch, don't just think about supplies for the person who needs help. Think about protecting the person providing that help too. 3. Thermometer. The third item I strongly recommend having at home is a thermometer. When someone says, "I feel hot," touching their forehead can give you a rough idea that something may be wrong, but it doesn't actually tell you their temperature accurately. A thermometer gives you an actual temperature reading, which can be useful when someone is feeling unwell, especially when you suspect they may have a fever. This is particularly useful when caring for children, because they may not always be able to explain exactly how they're feeling. Keep the thermometer somewhere clean, dry, and easy to find. And if you're using a reusable thermometer, follow the manufacturer's instructions for cleaning it between uses. But remember, the number on the thermometer is only one part of the picture. If someone has a very high temperature, is unusually sleepy or difficult to wake, has trouble breathing, has a seizure, or looks seriously unwell, don't just keep checking their temperature at home and waiting. They need medical attention. So instead of guessing whether someone has fever by placing your hand on their forehead, Keep a reliable thermometer in your first aid kit. 4. Antiseptic and wound cleaning supplies. Next, your first aid kit should have something you can use to clean minor wounds properly. When you get a cut or scrape, the first priority is to remove dirt and other contamination from the wound. For many minor wounds, clean running water is suitable for cleaning. You can also keep appropriate wound cleaning supplies in your first aid kit, such as sterile saline or a suitable wound cleaning product. But here's an important point. Don't assume that every strong-smelling antiseptic is better for an open wound. Some products can irritate tissue or aren't intended to be used directly inside wounds. And please don't put things like toothpaste, cooking oil, butter, powder, or other household substances on an open wound just because someone told you it's a traditional remedy. After cleaning a minor wound, you can cover it with a sterile dressing or appropriate bandage. If the wound is deep, badly contaminated, caused by an animal or human bite, has something stuck inside it, or the bleeding doesn't stop with firm pressure, that's when you should stop relying on home first aid and seek professional medical care. 5. Medical tape and bandages. Another useful item to keep in your first aid kit is medical tape and a few different types of bandages. You may already have adhesive plasters, but they aren't suitable for every situation. Sometimes you need to secure a piece of sterile gauze over a wound, or keep a dressing in place without putting adhesive directly over the injured area. That's where medical tape can be useful. It's also a good idea to have bandages in different sizes, because a small finger cut doesn't need the same type of dressing as a larger scrape on the knee or arm. When applying a bandage, it should be secure, but not so tight that it restricts circulation. If the area becomes increasingly painful, numb, cold, pale, or changes color after a bandage is applied, it may be too tight and needs attention. Keep your dressings clean, dry, and preferably sealed in their original packaging. And check your supplies from time to time, because having a first aid kit isn't very helpful if everything inside it is damaged, dirty, or expired. The goal is simple. When a minor injury happens, you should have a clean way to cover and protect it until it heals or until medical care is needed. 6. Small scissors and tweezers. Next, keep a pair of small scissors and tweezers in your first aid kit. They may seem like simple tools, but they can be surprisingly useful when you're dealing with a minor injury. Scissors can help you cut medical tape, gauze, or bandages to the right size. Having a dedicated pair in your first aid kit also means you don't have to start searching through the kitchen drawer when you need them. Tweezers can be useful for removing a small, easily accessible splinter or a tiny piece of debris from the skin. But there's an important rule here. Don't dig around in a wound with tweezers. If something is deeply embedded, difficult to remove, located near the eye, or you can't easily grasp it, don't keep trying to pull it out yourself. Get medical help instead. And before using these tools, make sure they're clean. After using them, clean them appropriately and return them to the kit so they're ready when you need them. These are small items, but they're exactly the kind of things you'll appreciate having when a minor problem suddenly happens. 7. Oral rehydration solution, ORAS. Another useful item to keep at home is oral rehydration solution, commonly called ORS. ORS is especially important when someone is losing a lot of fluid and salts, such as during diarrhea or vomiting. It contains a carefully balanced combination of water, salts, and glucose that helps the body absorb fluids more effectively. This is different from simply giving someone a sugary drink, soft drink, or energy drink. ORS is specifically formulated for rehydration. If you keep ORS at home, store the sachets somewhere cool and dry. And always check the expiry date. When preparing it, follow the instructions on the packet carefully and use the correct amount of clean water. Don't guess the amount of water or make it extra concentrated. Once prepared, use it according to the instructions and don't keep a prepared solution longer than recommended. And remember, ORS doesn't treat the cause of diarrhea or vomiting. It's mainly helping to replace lost fluids and electrolytes. If someone is severely dehydrated, repeatedly vomiting and unable to keep fluids down, has blood in their stool or vomit, becomes very weak or confused, or is difficult to wake, they need urgent medical attention. 8. Check your first aid kit regularly. Having a first aid kit is only useful if the things inside it are actually ready to be used. So don't just buy everything. Put it in a box and forget about it. Every few months, take a few minutes to open your kit and check what's inside. Look at the expiry dates on items that have them. Replace anything that has been used and throw away anything that's damaged, contaminated, or no longer suitable for use. Check that your bandages and gauze are still sealed, that your thermometer works, that your flashlight has working batteries, and that your oars sachets haven't expired. It's also a good idea to keep the kit somewhere that adults in the household can easily reach during an emergency, but away from young children. And make sure everyone who may need to use it knows where it is. Because imagine having an emergency and spending 10 minutes asking, "Where did we keep the first aid box?" Preparation means knowing what's inside, knowing where it is, and making sure it's ready before you actually need it. And lastly, basic medicines to discuss. 1. Paracetamol acetaminophen, commonly used for pain and fever when taken according to the label. 2. Antihistamine can be useful for certain mild allergy symptoms such as itching or sneezing. Some can cause drowsiness. 3. Oral rehydration salts oars, useful for replacing fluids and electrolytes lost through diarrhea or vomiting. 4. Antacid may provide temporary relief from occasional heartburn or indigestion. It isn't appropriate for every type of abdominal pain. 5. Your prescribed medicines. If someone in the household regularly takes prescribed medication, keep their medicines properly labeled and stored safely. Don't share prescription medicines. 6. Avoid stocking antibiotics just in case. Antibiotics should only be used when prescribed appropriately, recommended for a bacterial infection. They aren't general-purpose medicines for fever, cough, or every wound. 7. Avoid random leftover medicines. If you don't know what a medicine is for, who it was prescribed for, or whether it's still safe to use, don't put it in the first aid kit. And there you have it, some of the basic things every home should consider having in a first aid kit. Remember, you don't need a huge box filled with everything imaginable. What matters is having the right basic supplies, keeping them clean and organized, checking them regularly, and knowing how to use them safely. And most importantly, remember that first aid has its limits. A first aid kit can help you manage a minor injury while you're figuring out what to do next, but it cannot replace professional medical care. If an injury is severe, bleeding won't stop. Someone is having difficulty breathing, becomes unconscious, or you simply feel that something isn't right, don't rely on your first AD box. Get medical help. So take a few minutes today and check your own first aid kit. If you don't have one, this might be the perfect time to start putting one together. Because emergencies don't send invitations, it's better to be prepared before you need it. If you found this video helpful, share it with your family and friends. Someone you care about may need this information one day. This is Health Verse, bringing you simple health information you can actually use. Stay informed, stay prepared, and stay safe. Thanks for watching. Please subscribe to my YouTube channel.